Good morning, and thank you so much for attending the CBT for substance use disorder issues. We'll be going over the two main concepts that we use to help with communicating better with patients, to help that collegiality so that as we work together to help them identify areas or even identifying the need for starting with treatment and then moving through their recovery, we can find some appropriate topics, some good resources for them, and to give them the skills that they need to be able to move forward in a positive way. So today we'll define CBT and how it's used in substance use treatment strategies, as well as some motivational interviewing tips that you may find that you can kind of thread through CBT along the way. Because when there's someone moving to a new activity or starting something that they may be unaccustomed to, they have that hesitance. They might find some internal or sometimes some conscious or unconscious barriers to moving forward, so motivational interviewing can be a really great tip in helping to go through that. We'll also talk about the most common CBT concepts that are related to substance use care, and as well showing clients how to really walk through their behaviors and so they can learn and see where they need to make those changes. And the antecedents, behavior, and consequences mapping is a great way to be able to do that.
Mm.
And we remember as part of this that we're always meeting the person where they are, understanding that we often may live in differing realities and worlds from where the therapist and the client may be, but that we're all trying to walk the same walk of life together really sets the stage for you to be able to meet someone where they're at. We empower people by hearing them and helping them to think through the changes that they're making. We listen and we give respect for their worldview and their opinions, and we recognize that they may see it one way. We may see it differently, but their way for them is real, has meaning, and is the best way to help move things forward. When we communicate better, when both people that are part of that communication dyad feel like they're understood in the present, when we're talking over, talking down to, or not connecting, that makes a difference, and that's off-putting for people. Then we can work together to help people decide to make the changes that can make a difference as part of their recovery world. Just reviewing the principles for motivational interviewing and the stages of change, we know that motivational interviewing is really underpinned by those principles of collaborative activities, the therapeutic respect, and the autonomy of the patient in their decision making process. So, within motivational interviewing, the therapist is really just viewed as the facilitator. They help clients overcome their obstacles and then helping them moving toward the positive change. So, the overall spirit of MI is to really work together to evoke the change and ideas from the patient, and then honoring their autonomy and helping them to bring them about. So, as part of the four principles of motivational interviewing, we know that we're expressing empathy, we're helping them to develop and see what their discrepancies are from what they're doing versus what they see themselves wanting to do. We roll with that resistance that we talked about earlier when someone feels hesitant about changing. And then we support their self efficacy and knowing that, hey, they can have the skills and we can empower them with the skills to make those changes. As part of the stages of change, quick just to review those just quickly, we know that when someone first enters a stage of change, they have no mention of thinking that they need to change their behavior. They're in pre contemplation. So, in regard to substance use, this may be the first time that they're seen by an emergency department. This may be the first time that they've overdosed on our Narcan. They don't know that their behavior is in need of change. For contemplation, they're aware that a problem exists, but they're not committed to change, or that they've not yet bought into saying, okay, I need to get off of this path. Uh, then when they realize they need to make a change, they may start what's called preparation. What are the actions that they may need to take in order for change to be able to take place? And then actually executing those changes is part of the action role of stages of change. And then maintaining that change as part of what we now call recovery and continues through that path, acting in ways that they need to act to continue to make changes, developing new behaviors as new issues may come up, and recognizing that as part of that stage, there may be a relapse or a lapse in sobriety or a lapse in whatever behavior they're trying to change. But we know that we roll right back into continuing action, and that for recovery there is no true termination and says, okay, this is done, but that we're continuing to roll through the maintenance of recovery toward continuing times of not use. So, for motivational interviewing, we really want to have more effective conversations about changing substance use. And when you think about if you're someone with lived experience, or what I frequently say, anything that you wanted to change in healthcare, if someone has said you need to lose weight, you need to lower your cholesterol, so you need to have fewer fried foods. Your blood pressure is high, so you need to chill down, to use stress management. Any of those activities involving changing your current behaviors. And we know the immediate, ugh, how's that going to happen? Oh, have you seen my life? It's not going to be able to change. So we know that immediate issue of resistance and how we want to work through that, whether we may have lived experience in substance use or lived experience of other behaviors that we need to change. And we know that previously, particularly for not only healthcare, behavioral healthcare, and substance use care, these conversations may not always work because patients don't always know or do what they should do because one, they're not sure what they need to be doing. And so part of that solution is helping them to see what they need to do to move past it. We frequently used to think, well, they were lazy or weak-willed. No, we tell them by showing why is it important. We ask them why is it important for them. That's how we gain their motivation to be able to make that change. We also used to say, no, they're in denial or they don't believe what the provider has to say. No, what we recognize is that patients are frequently scared. They may need convincing or persuasion, or they need to understand what may be the positive consequences for having a change to the behavior. And sadly, in healthcare, we frequently kind of have that patriarchal system where we're kind of talking down to the patient. You should do this, you should do that. And the patient may say, well, wait a minute, how does this benefit me? How does this motivate or move me from where I am? So the discussion for motivational interviewing is actually help to giving them the keys to see how behavioral change can make a meaningful difference and importance for them. Part of what past healthcare communication has been like a tug of war. Well, I know I should keep drinking if a patient is saying this, but it's the only way I can sleep through the night without the nightmares. And typically, a provider may say, you're right. You really need to cut back on your alcohol. If you don't, then you may have liver issues. You may have kidney issues, your diabetes. But the patient may know all of that. But if I don't drink to go to sleep, I wake up with my heart racing out of my chest. I feel like I'm back over in Iraq, and then there's no way that I can get back to sleep. So moving away from this tug of war from the patient to actually having that conversation where you're hearing the patient actually can help with building an alliance for your patient. That same patient saying, I know I should quit drinking, but it's the only way I can sleep through the night without the nightmares. Then saying, if it weren't for the nightmares, would you be okay with cutting back? Then you can see that the doctor has listened to, in this case, the doctor has listened to what the patient has said, the patient's rationale for why they're drinking, and address that concern or issue, not just the should of quitting drinking. So when you make that change, well, if it weren't for the nightmares, would you be okay with cutting back? A patient may say, oh, yeah, I'm fine with it. I know that, too much alcohol isn't good for me and it'll probably just make things worse in the long run. But you've heard the patient, you've heard their rationale, and now you can provide them an alternative that can help them make those changes in behaviors. And that alliance is what we consistently need to build in working with patients. How do you build that alliance? First, expressing empathy. And I'm going to use this same case so we can walk through it together. I know I should quit drinking, but it's the only way I can get to sleep. Well, it sounds like the nightmares that you're having are really affecting your sleep. And how can you find peace in your evenings without drinking? Then developing the discrepancy. What in your life would you think would change if the drinking were removed? So you're having the patient think about what would be that alternative? What could be a positive consequence if the substance behavior was not there? Then if your patient may have some resistance to them, you're rolling with it. You're not saying, well, you need to do this and stop that conversation. So the patient says, well, I know I should quit drinking, but it's the only way I can sleep through the night without the nightmares. So the provider says, well, on the one hand, you want to stop drinking, but on the other hand, it sounds like that how would you cope with your nightmares and sleep concerns? How would you feel about talking through different sleep strategies with me? And then to see how that would help with your sleep so that you could stop drinking. So you're rolling with that resistance of the patient saying, well, I'd like to quit, but I can't sleep. And then you're giving them that coping strategies to empowering them to be able to support their self efficacy. So if you're treating the individual as he will stay as he is. But if you treat him how he wants to be and where he wants to be, then he can become what he ought to be and can be. And that's that for part in motivational interviewing that empowers the patient to make that change. And then you would provide the sleep activities, maybe some relaxation exercises for sleep, telling them about things like the rain or listening to the rain or the beach sounds that can help with calming sleep, and then can work with them on lowering their alcohol intake as their sleep is improving. And anytime you're talking with a client, I always remind the residents that I work with, folks that I'm training, people do the behaviors that they may be wanting to change for a reason. So even when you just ask, what does drinking do for you? What does using heroin do for you? And then you may frequently get to the issues and the rationale that the patient may have. It frequently is issues with trauma, covering trauma, being able to go to sleep at night, like this patient reported, or other issues. Or, well, when I first started, it was because I was having flashbacks, or I was thinking back to when I was a child and may have been molested. And then you'll know that you actually need to treat the issue that may be the patient's rationale, as well as the current substance use or other or change behavior. One great way that we can look at change behaviors, and I'll explain to how you can practice on your own as you're listening to this, is to using the keyword, and motivational interviewing has lots of good acronym words, so it's easy for you to remember what to do, called OARS. And that's open questions to explore the patient's concerns, promote that alliance and collaboration, and to hear the person's perspective. Because remember, that part's really important. It isn't part of the usual healthcare. A for affirmations, supporting their strengths, conveying respect for what they've tried to do, what's worked or what's not worked, and then listening to see and hear what they may come up with as potential ideas. Reflective listening is the R, to explore deeper, to convey their understanding, deflect any discard, or elicit that change talk of saying, well, if I could sleep better, I could be able to cut back on my alcohol. And then five, to the S of summarize, to organize the discussion, clarify their motivation, and to provide the focus on the session to what the next talk will be. So we'll walk through these ORs, these initials, by looking at this client's case. So your 32-year-old client with a 3-year history of heroin use recently took an overdose and had to be revived by Narcan. You're talking with her after she was discharged from the hospital. She's unsure if she wants to start a treatment program, but she does know that she needs help. And so this will help you to see what are the next stages in looking through the ORs that you could discuss with her. So let's talk about the open-ended questions. When you're new to motivational interviewing, determine how and where to start can be a little tough. The five, these good five open-ended questions can be a really great start. Tell me why you may want to make these changes. How might you go about making this change? What are the three best reasons that you might have for doing it? How important is it for you to make this change right now? And why? And then what do you think you'll be able to do? And so even those tips give the client an opportunity to really explore their thoughts, to discuss their concerns, and you're listening to the client, which really can give them some important feedback. Because sometimes client may not make that change talk initially, but as you're discussing those open-ended questions, ask the client, what's the worst case scenario if change doesn't happen? and the best case scenario. Right away with this case, well, the worst case scenario, I ended up accidentally overdosing, and I had to go to the emergency department. What might be the best case scenario if we could talk about making some changes? Then looking back, asking the client to think back to a time before this problem began. What did life look like? And sadly, when clients are in their substance use cycle, they frequently can only see right now, and sadly, the damage that may have happened in the past. What you're asking to do is actually to look back before this even started and say, what was life like before you had the substance use problem? And then having them discuss what they see were the positives of their lives. What you may also hear at that time, what may have been issues that may have started the substance use, such as trauma, other issues, and that will give you the clue as to their rationale for substance use and ways that you can also intervene there. And then ask them to look forward. Okay, in 3 months, when you've been in treatment and now are starting your recovery and have 3 months that you've cut back or changed your use, what's that going to look like? Because then you're giving them some hope. Remember, clients are right now stuck in the here and now. That's why sometimes their decision making and some of the activities and behaviors that they do are just focused on the here and now because that's where they are. Asking them to look forward when this is better, when you're getting treatment and in services and in housing, what's that going to look like? And then you're going to give them some hope on how they can move things forward. And then explore their goals and values and how they can make this change long term. These are some more practice examples. And as you go back and review the video and the handouts that I send as part of this, you can actually practice some ways to make these statements. What are some positive affirmations? Building rapport, the effective ways to notice patient strength. Oh, well, it sounds like in that instance, you were able to make a good choice. What helped you to choose not to use that time? And you're helping the client identify a strength that they could use in the future. Using reflection, rephrasing a statement to capture the patient's meaning or helping the understand what the client said. Encouraging the personal exploration of and helping them to understand their motivations. It sounds like the effects of alcohol may have helped you to unwind at the end of the day, but it sounds like you also, felt self-conscious when you were with friends. But then now you're beginning to worry about your health. Tell me more about that. And that word, I know frequently sometimes "tell me more" is something sometimes used as a catchphrase or a joke in terms of therapy, but telling someone more actually helps to open up for what are those reflections that a client may have. And how can you then amplify or reinforce their desires of change by those reflections that they make? Another great way to discuss working with a client is that confidence ruler for change. On a scale from 1 to 10, how confident are you that you can make this change? And the patient may think through, I'm maybe a 5. Okay, if you're at a 5, how come you're not at a 2 or 3? And it actually challenges the client to think through why they're at that stage. Well, I've done that before and I realized it didn't work that. So if I feel like I want to go into this neighborhood, I feel like I'm at a 5. I can use that to not go through that trigger again. Okay. And then what would it take for you to get to a 7? And then you're helping the client identify the skills that they need to build to move from that 5 that they listed as their confidence ruler to the 7. And then you can list that and have them write them down in their change plan. And what are the activities that they can do to help move through that change plan? As you're practicing using these oars, a great way to be able to do this is actually to kind of think through as you're talking with a client and recording. Okay, am I asking open-ended questions? If I'm asking too many closed-ended questions, I may be actually stifling the clients being able to speak more or reflect or feeling like they're being heard. Am I using positive affirmations and encouraging them in the strengths that they do have? Am I using reflective statements that may help to find the rationale of why they may be using? And then am I summarizing things so that when we end our therapy session or end our session, our time of working together, and what I consider is anytime you're meeting with the patient, that's a therapy session because you're going to listen to the patient, you're going to hear where they are, you're going to help them to move to that next step, and you're going to summarize some activities and some skills and give them some props in being able to use those skills in the future. So this is a great way to be at to look at how you're doing with that type of change talk. And now moving to cognitive behavioral therapy, we recognize that we're self-determined by the meaning that we give our experiences. And there's probably something a mistake involved when we think that a particular experience is the basis for all of our future life. But think about what we frequently tell ourselves. Oh, I messed up this one test. It's going to mess up the whole rest of my life. Oh, I did badly. I said something off on this date. It's going to mess up the whole trajectory potentially of this relationship. Meanings really aren't, though, determined by situations, but meanings are determined by what we give to the situation and how we think of the situation. So when we can change the way that we think about a situation, we can really make a difference in changing the way we not only see ourselves, but in the way that we behave and react in situations. And that's the gist of cognitive behavioral therapy. So, understanding the main cognitive behavioral concepts are a situation occurs, and a situation basically is neutral. Okay, you say something that you thought was a joke, and it lands flat, or there's an activity. Oh, this happens. But what immediately happens is our automatic thoughts that are frequently, sadly, based on issues of trauma, our past experiences, our own feelings, sometimes of inadequacy. And those automatic thoughts then trigger our reaction. We get offended, we get more angry, we get defensive, we get more aggressive. And those are the things that may lead to those issues of our emotion, our behavior, and our response that may happen physiologically, but they start cognitively in the way that we think about the situation. So when we change these automatic thoughts, we can make a significant change in the reaction that we have. And that's what we want to help clients to be able to do. Those automatic thoughts are based on our core beliefs, the way we view the world, the way we've seen and have and developed from our experiences in the world. And then the activating event is the thing that happens for us, saying something out of place or something may be happening. And then our thoughts are how we interpret that event that are based on those core beliefs. Then that reflects in our emotions. Do we feel ashamed? Do we feel hurt? Do we feel angry? All of this, once again, is developed by our core beliefs. And then our behaviors, how we act based on those core events that take into consideration all of the above. And sadly, our clients have had negative views about the world. They've sadly had negative experiences in the world from trauma, early childhood experiences that may have led to a negative view about oneself or self esteem, poor feelings of efficacy about making a difference, and negative things about views about their future, seeing that they may have a foreshortened life because they live in an area that may experience crime, gang related issues, or substance use, feeling that, okay, things are never going to work out for me because of how my parents did or because of issues that may have occurred otherwise. And these negative views about the future then have the world feeling that way. Nobody cares about me. No one cares what may happen to me. Other people don't care or like me either. That it and then you see how that circle and cycle can then may affect how someone might think about an activating event, their thoughts about something that may happen, their emotions about it, mostly negative, and then their behavior. So, some information on core beliefs, and these are things that can trigger people, maybe places, maybe times, maybe activities. But core beliefs have been molded throughout our lifetime experiences. The trigger occurs and is interpreted through their beliefs. So these internal feelings rise up because of past experience, and they rise up when they may be triggered again. The behavioral response then occurs based on that thought or feeling. And it may be helpful, it may be unhelpful, but that behavior is viewed as that response. And then that response then enforces the core belief. See, they did this, or I responded in this way, and see, I told you they would do that. And then fortunately, the cycle continues. We see a lot of times where this may happen, particularly in substance use. Here's an example. There might be a fight or an argument, and that may trigger those negative thoughts. The negative worldview. See, that person doesn't care about me. They don't like me. The automatic thought, life is fair. I deserve better. Why is this happening to me? Then that brings up a whole crop of feelings being angry, frustrated, sad, hopeless. And then someone may cope with those feelings by using substances, alcohol, or drugs. It may immediately change their feelings. It might even help them to forget if they drink till they black out what even happened. But unfortunately, the drug wears off. That frustration, that irritability, that hopelessness comes back. And then the next time they're triggered, they have that same cycle. Then the negative worldview, the automatic thought, those feelings that aren't comfortable, and then the response of coping with a substance. So CBT tries to help clients change that behavior, which is using substances, for a better consequence. So whenever a behavior or what we frequently call a trigger may occur, we'll say, okay, what was happening before? What happened prior to that triggering behavior? And then what did you do? The behavior or the substance use. And then what was the consequence? What happened after that behavior was demonstrated? And that way, the time period when or the places where a client may use their internal cues to use or their internal emotions that may trigger drug use is why people with whom the client may be using or why they may buy drugs, all of that may become part then of that discussion. And then what you do as the therapist affects how the client may either receive the drugs, what the drugs do for them, or then what happened after they use drugs. So you'll actually walk a client through what actually happened. Oh, well, I had a fight the other day with my girlfriend, and yeah, I relapsed and I used some substances. Okay, so let's kind of break this down a little bit. So what was happening before? You said I heard you say you had a fight. Tell me about what happened, and then you'll go through what issues may have occurred for that fight to happen. And then what did you do? Well, then I left the house or I texted this guy, and you'll actually go through what the behavior was. And then what happened after you used? And you'll go through those areas too. And this way, you actually can develop a functional analysis of these triggering behaviors. So, where was I? Who was with me? What was happening before? What were you thinking before this happened? And how was your mood and feelings before this happened? Well, once I argued, what kind of signals did you get in your body? And then talking about the behavior. What did I do? How did I use? How much? Who was around me when I used? And then the consequences. What happened after? How did I feel right after? How did other people react to my use? Any other consequences? And then you can actually break down what additional and now new behaviors they can do when these antecedents, the thoughts, and the feelings occur. And then this is part of this is called the cost benefit analysis because you're actually looking at the advantages to continue using and the disadvantages of the continued use and advantages to changing behavior and then disadvantages of changing behavior. And you're helping them find what might be some motivations. And remember, that's part of that motivational interviewing to be able to make a change. This can be really helpful and useful too when a client has an important decision to make. Well, I know I have a court date coming up. I know they've been giving me random testing. So what are the advantages to continue using right now when you've got this potential random testing coming up. And it's especially when a client is having difficulty identifying the steps towards what they may need to do, using this cost benefit tool and then helping to walk through those ABCs of the behavior can help the client organize his or her thoughts about being able to get ready and using those new skills for changing an issue. An additional tool that we can use in problem solving is called ITCH. And as I said, there are lots of acronyms for helping to use these because you can actually teach your client how to use these same acronyms to work through their problem solving. Identify the problem. Okay, I've got a court date coming up and I've got some randoms that they'll maybe be happening. Think about the possible solutions. I need to try to get a negative test so that when I go to court, they'll be able to say I'm having a negative test for my diversion program. How can we choose the solution to implement? Okay, I'm going to work with my therapist on those ABCs and start to learn some different behaviors besides using Or I might also go and talk to that other doctor that was talking about using what do they call the MOUD, medications for opioid use disorder, to be able to have as a solution so that I won't perhaps relapse on heroin and then have a positive test. And then checking to see how well something works when they do make those changes in the choices of the solution. So the itch for problem solving can be really helpful for a client to be able to use in the heat of the moment to say, hey, what are some things that I can do to make a better decision? Now, when you want to take some practice time, a great idea and a way to practice this is to draw and explain a condition for consideration of the decision making, asking and discussing the pros and cons of the decision, having the client role play, using the correct decision and getting feedback, and then asking, okay, are these all the reasons that may affect that decision? And then how will you evaluate using that decision? Did it work for you? Did it not work? What could have worked better? And so, what can you do next time? And this will be a great practice that you can do as you're going through this video later. Once again, thinking through that cognitive triangle, our thoughts about something that may occur then generates the feelings, sadly, frequently negative, and then the behaviors regarding substance use that may be negative too. So, how can we change those feelings? And you can actually show this to a client, and they'll say, yeah, I'll notice that. I was thinking about something, then I got frustrated. And then, yeah, so your thought, the frustration was the emotion. And then I got so frustrated, I feel like I needed to go to use to just chill out. There's your behavior. And helping a client see this can help them to be able to knock through those behaviors in a better way. Another good thing that can really help clients see how their thinking may be leading to emotions that are more negative and then behaviors that may be negative, are talking with them about their cognitive distortions. Now we all have cognitive distortions and we're all trying to work towards improving them. Frequently you may hear these also listed as unconscious biases. And when we talk about HR and working in diversity, inclusion areas, that may be an unconscious bias. That is a cognitive distortion, a thinking bias that we use in our regular day to day life. But cognitive distortions for patients can really be problematic and can unfortunately lead to feelings that can be negative and then the behaviors that can cause and lead to negative substance use. So, how do we challenge these cognitive distortions? And they may include such as all or nothing thinking, catastrophizing, feeling like the other person with them should read their mind, the could, should, or must, making things too personal when they are just general, discounting when someone makes a positive comment, magnification of something that's a molehill, or minimize something that's a mountain, overgeneralization, emotional reasoning, labeling something, or using a mental filter that can be negative, or jumping to conclusions. Just because someone says one thing, it may not mean that's what they mean. So, how do we teach our clients to challenge those cognitive distortions? We learn and work with them to ask, how do I know if thought is accurate? What evidence do I have that may support this thought or belief? How can I test that assumption to really find out? Do I have a trusted friend I can check this out with me? I can talk this through to see if I'm really thinking the right thing. And there are a number of different ways that we can challenge cognitive distortions here. One real quick way is to ask what we call the Socrates or Socratic questions. What's the evidence that my thinking is true? What's the evidence that it's not true? And sadly, with some of the disinformation out there these days, it's really handy to be able to have these questions to use. What's the worst thing that can happen if my thinking is true? What's the best thing that can happen? What's more likely to happen? And then what's an alternative viewpoint? And then is there someone I can touch bases with to see if they may see this alternative viewpoint? There's some really great handouts that you can give your clients to help with recording their automatic thoughts, testing their thoughts if it's true or not, and developing good coping skill cards that you can role play and practice with your clients and then hand out and review for your sessions on these websites, Therapist Aid and SitePoint. And they're particularly focused and geared for those cognitive distortions that may relate to substance use. And so, what should a therapy CBT session look like? When you immediately come in to check with somebody, and this can be from peer support to a therapist to a prescriber's appointment, the initial discussion should be a mood check. How are they today? Where are they right now? And I have a big map with all the different faces of moods from happy, sad, frustrated, stressed, um, sleepy, so that they can really, if they sometimes have difficulties kind of identifying their mood, they can identify the face. So, doing a mood check. And then setting the agenda for the session. So, what are we going to talk about today? Bridging from last section. Anything happened in the past week or so that you wanted to review? And that's a good time to be able, if there was a relapse, to open that up so that clients feel comfortable disclosing if they had a relapse in substance use. Yeah, on Friday night I was out with friends. It was payday, and yeah, we decided I did, use just a little, but I did what, and you can check. Did you use just a little? Did you never use alone? Did you use one at a time? So you can check harm reduction there too. You can also, and then talk through what were the antecedents. It was payday. I was with my friends that used. What was the consequences? And then go through that with them. Then you can talk about the agenda for today. If there's a new CBT activity that you want them to learn, or identifying how it's used, practice to role play it together. And then you can actually use that bridging from the last section to discuss how you're going to work on your homework. So, next time that happens, when the next paycheck comes, how are we going to incorporate that new CBT technique? How would it work? What would be the opportunity to use it? What's going to be the antecedent? What's going to be the behavior this time? And then how are you going to check the consequence of it and see if it helped for you? And then summarize what you discussed throughout the session. And then at the end, ask, so what's going to happen this coming week? You're going to have another payday coming up. Anything else happen? You have a court day coming up. And then that allows them to recognize times when they can use those decision making skills that we talked about earlier, too. And then ask for feedback. And how do you think that this helped today? Did this make a difference for you? What would you like us to plan on in your further goals? And then once again, you're always letting the patient be part of that decision making. That's so powerful and empowering and powerful. So empowerful for patients to be able to see that, hey, they're part of this too. They're not just coming to the program or coming to your therapy to listen to you, but you're actually working with them together to try to make things go better. And then help clients to see what type of knowledge can be gained. Clients can become more aware of their internal processes and when triggers may occur so that they can do some prevent defense. If they like football or basketball, it's great to use some of those same wordings and colloquialisms too. Well, let's do the prevent defense. All right, well, now who's going to run point on this? So that you can actually incorporate those CBT terms as you would an activity or something that they like. Okay. Give words to the mental thoughts or images that they may have. It also helps clients become more aware of how triggers occur and the coping skills that they can use, when they happen in context, and then how to retrain the brain to help in making those responses. And it really helps clients to build those connections between their thoughts, feelings, triggers, and actions. Because unfortunately, when people have had trauma, and there are two types. There may be the trauma before someone started using, and the trauma that someone may have experienced while they were using. They basically kind of partition off their thoughts from their feelings because sadly, the thoughts and their feelings may frequently trigger their substance use. So you're helping them to become aware of their thoughts and feelings, but without necessarily then the craving to use or to relapse. And you're rebuilding that connection of people to be able to feel more in the moment with themselves, with how they relate to people, and how they're working through their lives. There's some really great apps that can help with CBT and substance use. Reset O, which actually needs to be prescribed by someone's uh, MAT or behavioral health provider. There's an app on your phone called CBT for opioid use, and CBTI, which is for sleep, for insomnia. And it's one of the few FDA approved CBT apps that actually has been shown to help veterans with severe insomnia related to PTSD be able to do much better in terms of their sleep. There are other ways that we can, that as you're listening to video, you can discuss how you can supplement your client sessions with apps, worksheets, and other activities. And then how would you evaluate how that's working for your clients? And talking with your clients about what's working best for you, having a worksheet that you have to keep up with, or maybe having them uh, punching holes in it and putting in a binder, or having apps where you can put your notes in your apps and then reflect it later in their phone if they have a cell phone. And then you can ask, how would you ask your client to evaluate what's working for them in the real world and to see that what they're doing is making a difference for themselves. And then finally, we know that with motivational interviewing and CBT,